Hi, I'm Dr. Sonia Sloan, better known as OrthoDoc, and it's story time. Honesty is not exclusive to the medical profession, but it's paramount to our line of work. In being honest to a patient, you try to give them the details and information they need to make an informed decision, an intelligent consent. From a medical professional, though, sometimes we sugarcoat what should not be sugarcoated. Things that are harsh facts, that are ill-fated promises, and even sometimes wishful thinking. I remember having a patient that had HIV at the beginning or the height of what medical treatment was doing. It was still looked down upon. It was still very scary for us to deal with HIV patients, which is totally not the norm at this point in history. However, this one patient had a very aggressive type of lymphoma, which is a result of the HIV. And it had not just shown up, but it had metastasized, and it was also in one of his bones that did break that we did have to fix. So in going in to talk to the patient, I was responsible to tell him how bad it was, where it had spread, and the likelihood of him surviving in the next 6 months. Unbeknownst to me, this guy was full of joy, full of life, full of energy. And I wanted to go in to make him happy and to give him some hope. But I understood what the numbers look like as well. So in being honest with him, not sugarcoating it, I shared the information and the trajectory of what he was looking at for the next 6 months. And he taught me a lot in that time period of just being okay with what he had to deal with, but also that my honesty about his diagnosis wasn't my responsibility to just make him feel good. It was responsibility to give him information that was factual and time, sensitive, as well as informed of what could or could not be for his life expectancy. And he was okay with that. So sometimes, rule number 13, it's about honesty. Don't make promises you can't keep, because it doesn't help you, and it definitely doesn't help the patient.